coronavirus patients as well as Americans who are losing jobs as ordinary life here in the United States of America grinds to a halt. Joining us now in the Situation Room, the former Trump administration Veterans Affairs Secretary David Shulkin, along with Leon Panetta, who served as White House Chief of Staff in the Clinton administration and Defense Secretary and CIA Director under President Obama. Secretary Panetta, the president signed what's called the Defense Production Act today, but he didn't say exactly how he plans on using it. What can he actually do with this new authority?
Well, I'm glad that the president enacted the Defense Production Act, because what it can do is give the president the power to mobilize industries in this country to produce what's necessary in order to deal with this enemy that we're confronting, this silent virus that is killing people. I hope that the president fully mobilizes our country in this war against this virus. He's beginning to take steps that are important, but I think a lot more needs to be done to identify the extent of the enemy we're dealing with, because right now the greatest threat to our country, to our economy, is the tremendous uncertainty about where we're going with this enemy.
Yeah, you're right. Secretary Shulkin, we keep hearing administration officials say they're using what they're describing as a whole-of-government approach. You're the former Secretary of Veterans Affairs. Do you think the president has been making use of every resource available to deal with this crisis?
Well, certainly the president alone can't solve this crisis, and the role of the president is really to be the convener-in-chief. I feel most encouraged when I see the task force and the president reaching out to the private sector, as well as allowing the career professionals in the federal government to do their job. And this is going to take, as Secretary Panetta said, a whole of the country coming together. We clearly need a lot more integration and cooperation. I'm most concerned about the public safety of the American public, and in terms of the health crisis that we're about to witness and the capacity of our health crisis, we're going to need a lot more cooperation at the local community level between federal, state, and the private sector. The big issue, of course, in pandemics, you see up to 35% of the healthcare workers unable to go to work because they're sick themselves or they have to care for people at home. And so we're going to need a lot more staff being mobilized to make sure we have the people to take care of those who need our help.
Important point. Also, Secretary Panetta, as you know, you're the former Defense Secretary. Two U.S. Navy hospital ships are about to be deployed, one off the coast of New York, another out of the West Coast. Is there more the U.S. military can and should do right now?
I think the military can play a very large role in trying to provide the support systems needed in order to back up, the health needs in this country. I'm glad that the hospital ships are being deployed. I would like to see the president deploy the military with regards to our ability to put MASH hospitals out there to provide additional tents and support systems to back up these hospitals that are going to be overwhelmed. I mean, the predictions are that within a few days, not just weeks, a few days, we may see hospitals begin to reach emergency situations. We've got to be able to have the military fully mobilized to be able to provide backup systems in order to help for the healthcare needs that are going to erupt in these next few weeks.
You think VA hospitals, Secretary Shulkin, are ready for this?
The VA system, of course, is the largest healthcare system in the country. It employs the most doctors and nurses of anyone. And this mission of being here for national emergencies is one that I know that they take seriously. So we need to watch and to make sure that there is an integration of the federal efforts and the private sector efforts. But Wolf, I will say I'm speaking to hospital leaders and frontline physicians around the country, and I am just in awe of what they're doing. These are incredible people. They're learning how to deal with this infection. They're working with the available antivirals that are out there to see what is working. They're readying their hospitals in ways that I think none of them have ever thought of before. So we have an incredible healthcare system in this country.